Welcome to Behind the Line, where we pull back the curtain on the challenges facing first responders and frontline workers. The work you do is unique, and so are the stresses that go with it. Join me as we tackle key issues to reduce risks for burnout, and as we work to support you in doing the job you love without sacrificing being the kind of person you want to be. Hey there, and welcome back to Behind the Line. I'm your host, Lindsay Foss. If you're new to Behind the Line, what you should know about me is that I'm a clinical counselor specializing in trauma therapy. And after over a decade working with first responders and frontline workers around issues like burnout, compassion fatigue, PTSD, and related OSIs, I've become a passionate wellness advocate and educator for those who sacrifice so much for our communities out on the front lines. Behind the Line is a place for us to talk about the real life behind the scenes challenges facing you on the front lines. I created this podcast with the hope of bringing easy access to skills for wellness, allowing you to find greater sustainability both on the job and off. As you know, if you've been loyally listening, we're wrapping up our series for September on alternative therapy interventions when talk therapy isn't working. At the start of this series, we covered why talk therapy isn't always effective. And since then, we've talked about psychedelic-assisted psychotherapy, as well as trauma processing therapies like OEI and EMDR. Today, I'm so excited to be here with Michael Mariano, who's an expert in the field of neurotherapy. And I'm really looking forward to sharing with you about this exciting and innovative area of psychology that I anticipate will be a significant direction for the future of therapy practice. So with that, let's dive in. Welcome, Michael. I'm really excited to have you here today. I'm so excited we were finally able to coordinate a time. It's like the greatest challenge on earth these days is coordinating scheduling.
Yeah.
I'm so glad that this worked out.
I'm so excited as well. Yeah.
Awesome. Okay, so let's start with a little bit of your kind of story and background. What do you do? How long have you been doing it?
Sure.
What are the primary pieces of your work that you're up to?
Mm-hmm. Well, I would say that, I started doing basically what's called neurotherapy when I was doing an internship for my master's degree in counseling psychology. And I think that's when I first really got into what I'm doing now, which is essentially what's called neuropsychophysiology, like the more broader term.
Much fancier now.
So much fancier, yeah. So you can see that it includes, there's neuro, there's brain physiology, and then just overall body physiology. That's important. So essentially I was doing my master's and I had to finish my internship. And I had a fortunate connection to be able to work at a clinic that actually did that. So they were needing counselors. And then essentially I got exposed to quite a lot of the more physiological measures, such as looking at brain electrical activity, measuring different things like the body as well. So things like heart rate variability. Right. So that just really connected to me. And I think that there's just so much that's present if you're able to actually access and understand what's going on in both the body and the brain. And so that's basically how I kind of started from that point. So I worked at that particular place for about, I'd say 10, 11 years. It's quite a long time. Yeah. So I saw, thankfully it was quite a blessing. I was able to see quite a number of different types of clients as well.
Yeah.
And that was really nice exposure for me because I was able to see basically different kinds of patterns or things that you might see in people's brain maps. And at some point, I just wanted to do my own thing because I realized that there's just so much out there in terms of what's, I would say, cutting edge right now. So there's different types of approaches, different types of neurofeedback training, different types of neurostimulation. I'll get into that as you ask questions, but there's just such a wealth of possibilities there to have for quite a number of different types of clinicians as well. So,
I mean, I think that's why I'm really excited to have this conversation and to get to have it with you of all people, because I think that there's lots of people who try to kind of touch into this area. We were actually talking about this in a phone call a couple of days ago, that there's lots of people who kind of try to add it as a little piece in their practice. but there's not a lot of people who make this kind of like the full scope of what they're doing and really
Right.
embrace like the depth and degree of it, because it is really innovative and it is really
Mm-hmm.
emerging. And I think what's really
Mm-hmm.
cool about it is across the board, I think the like top people in this field agree that this is the future for
Mm-hmm.
therapy, that accessing more and more about the brain, understanding more and more about the brain, being able to
Yes.
give people
Yes.
feedback about how their brain is
Right.
currently operating, what it looks like for it to optimally operate, and how we get
Mm-hmm.
from here to
Mm-hmm.
there using
Mm-hmm.
mechanisms that work with our brain is really the
Yes.
future of what healing is going to look like. So I am so
Mm.
excited to have that conversation with you, because I think that you're the person I know who is the
Yay.
furthest along in kind of being on that cutting edge piece.
Right. Yeah. And I think we can talk about that at some point during the interview. Just some thoughts that I have about why maybe you might not
Mhm.
necessarily see too many people doing it, or they're trying to do it as well, but there's a struggle to integrate it. So I think there's a number of
Yeah.
reasons that we can discuss.
Totally. Well, and I think we kind of circle back to that in a bit. I know one of the questions
Mm,
I have kind of further down the
okay.
road is, why isn't this used more conventionally?
Right.
And so I'd
Okay.
love for us to kind of circle there in a little
Sure.
bit. For now,
For
let's start
sure.
out by maybe you giving me a bit of just like, tell me about the approach that you use. Tell me about what it looks like and how it's different than conventional therapy treatment models,
Mm,
because it's
mm.
really different.
And then treatment compared to, say, something like counseling, psychology,
Yeah,
psychotherapy. Yeah.
totally.
Well, I think one of the big things about it is that you're able to actually measure and understand something that's actually very tangible. So when you're
Hmm.
thinking about counseling and psychotherapy, you think, okay, well, someone is feeling depressed, sad, anxious. But all those things, conditions, symptoms, they all have physiological correlates. I mean, your experience is
Yeah.
based on what your brain, what your body is doing. So it just makes so much logical sense to try and understand and explore how our brains are functioning
Yeah.
and our bodies, but specifically brain is what we're referring to here within neurotherapy. And so there are
Yeah.
means to do that. And one of the ways to do it is you basically measure brain electrical activity. That's one of the main things that I do with the neurotherapy that I do.
Right.
And
Yeah.
with that, what happens is you measure a brain electrical activity at the scalp of the head, so just at the top of the
Mhm.
head. But from that, there's just such a wealth of information. So different kinds of measures that you can look at how your brain is functioning, the different parts of the brain. There's areas that are called what are called Brodmann areas that you can specifically look at to see, oh, if you have trouble with speech, well, it would make sense that the part of the brain that's important for speech and language might be affected. So why don't we look at that area and actually address it and
Mhm.
see what is going on there? So
Yeah.
I might be getting ahead of myself, but basically, I think one of the most important things to start with when you're doing neurotherapy is absolutely a really comprehensive assessment to see how your brain is
Yeah.
functioning. And so, what I mean by comprehensive is that you want to kind of embrace different types of measures and approaches to really try to understand as much as you can to help both yourself as a therapist and the client to understand how the brain is functioning. And I
Yeah.
think, kind of to allude to what we might talk about later, is often when people are trying to do maybe neurofeedback, I think they're not starting from that singular important piece, which is you don't want to miss things that are important when you're doing an analysis. And I think
Totally.
if you look at some of the approaches that people have with neurofeedback, often it's just one modality, or it's just one approach,
Yeah.
or just one kind of system that they might use. And that could be
Mhm.
very good. But again, if you really want to, I think, affect more positive, specific global change, then it does start from that comprehensive assessment. Yeah. So
I
that's
mean, I
the
think that makes a lot
neurotherapy.
of sense.
Hmm.
Yeah.
Hmm. Right.
Like, I
I
mean,
think
I
it
think about it
sounds
like,
logical.
well, and I mean, like, I think that the contrast or comparison, I guess, that resonates with me in terms of what I think people would maybe be familiar with is I get a lot of clients who are like WorkSafe or ICBC clients who had some kind of injury, right? And they'll go for, initially if they were hit by a car, they have, discomfort and pain in their neck and shoulder. And so they'll go for the like CT scan or X-ray or whatever
Yes.
that is like really located in this one area. And then they'll go for physio that directs that specific area for improvement. But often they miss because they didn't do the like full scan of this whole like they missed that like ribs were out of place and that right like the shoulder is popped up funny, that there's all of these other injuries. And so they do physio on this, but they don't necessarily get better because they haven't done a comprehensive enough of an assessment to be able to really identify all of the things and how they inform each other, right? Like my neck is informed by my ribs. And so if my ribs are out, my neck is always going to be shifting to compensate different, right? Like it's always going to stay not quite healed because it's reliant on other parts of me being functional as well. Right. And so I love this idea of a comprehensive assessment because it just makes sense that you would want to know, especially in like our brains are so intertwined. Like when I think about our brains, I think about it like a ball of yarn. Like there's no one part that is fully and totally independent of every other part. You can't 100% just isolate and know, well, that's the problem because there's so much interconnection.
Right. And that makes a lot of sense because I've seen, for example, people where they really just kind of swear by a certain kind of assessment that isn't comprehensive, in my opinion, where you would measure just a few spots in the head, for example. And you can get information that's important and useful, but then you just miss out on so much. So, for example, if you're trying to understand deeper structures in the brain, there's actually no other way except by using some of the more standard multiple channel recordings that you can do with quantitative encephalography, which is the name of what the assessment is that I do. QEEG, if people don't know what that is.
So I'm curious. This is like a very different approach. So you were in your Master's of Counseling Psychology program. And we were in the same program. I was a couple of years behind you, I think. And out of that, you emerged into this thing that is very different than I think what that program tends to really focus on or promote in the types of therapists it imagines it's going to put out. And so what drew you to neurotherapy? Like, what did you find you got the most value out of in it that really drew you to it?
Well, I think it's actually what I already just mentioned, that the brain is just so important with so many things that we experience. Like just name any symptom and there's a brain correlate to how you're actually experiencing that. So it just makes sense that you'd want to look at that and try to understand it as best as you can. So essentially with neurotherapy, at the very least with a comprehensive assessment, you can get a better understanding of like something that's more validating for a client. It's more tangible. It's an actual physiological measure. So again, like when someone comes in and they might have anxiety, well, what's interesting is you can have very different reasons why you have the anxiety, but you likely won't understand that until you actually see, okay, how is your brain functioning? You're actually not getting good sleep. So maybe that's contributing to your anxiety, less so than this disorder that you might have been given. And so you might see a condition like that. Another example would be, just a huge one. So oftentimes people have, for various reasons, concentration problems, right? So you'll get kids that get diagnosed with ADHD, attention issues, but then there are times where if you look at the brain, you might actually see that, I don't actually see any major cognitive deficits relating to attention. You have some emotional regulation issues. You have sleeping problems. You have anxiety. And that is likely what's contributing to your problems with concentration. So that also leads to why I think some more conventional methods. So if you look at psychology, but then also would say with medicine, where it kind of is lacking, they also don't have necessarily a comprehensive assessment. And that's really interesting because here you are having medications that have very specific effects, it makes sense to try and understand the brain before you actually say, oh, this person might benefit from a stimulant to help with their concentration. It might, and it might actually have very useful applications. But oftentimes, if something like that happens where someone has more of a brain that doesn't shut down, you don't necessarily want to have some areas of the brain stimulated. And that's where you need to go, oh, it's kind of mixed. It works, but it doesn't. So again, I think the brain assessment is quite a huge factor into having a positive experience with neurotherapy.
I mean, it does just make sense. I love some of the examples that you've brought up. And I guess I'm curious, if we kind of shift gears a little bit, what are some of the advantages for this approach for neurotherapy in working with people who are working on the front lines and tend to have some of the specific challenges that are common to that professional group? So like burnout, depression, anxiety, PTSD, and other kinds of occupational stress injuries. Where does it fit for that, do you find?
Wow. So we can talk a long period of time on each of those symptoms. So I'll just give an example. Let's see. So you mentioned, like, for example, frontline workers that what's a common symptom or condition that they might have? PTSD. Absolutely.
Yeah.
You experience negative experiences in the workplace. And what's amazing is that I honestly think there's not enough support and understanding of how to actually address that. It's almost like people are just left, that's just your job. You just have to kind of stick with it and you get used to doing it. But absolutely, it has an impact on how you function, what you subjectively notice, but then even the brain. And so I'll give you an example. With PTSD or just trauma in general or negative experiences that you have, whatever you might call it, the brain, one possibility is that there are protective measures, and these are healthy things. So if you get exposed to something that's very traumatic, very, very tragic, for example, the brain might be overwhelmed by the emotional intensity of that. So you can actually see some patterns that emerge when you do a brain map to say, oh, look, it looks like the brain is increasing certain frequencies, like maybe theta or low alpha. And that could be an indication that the brain is basically shutting off, like it's trying not to connect to these visuals of what was experienced or even other types of stimulation that it experienced. So that's a good protective measure at that time. But then, of course, what happens is that measure persists. And so in your everyday life, you still see people kind of withdraw, for example, or literally there are obvious markers for dissociation that occur. And so, again, that's something that you can actually see in the brain map. And then if you do see it, then it just makes sense to go to that area of the brain that you're seeing it, try to optimize it. And then absolutely, you'll likely see a change or shift in your symptoms because you're actually affecting change on what's stuck or what's blocked. So, I mean, again, PTSD is one of the examples there.
Yeah. Okay. So I feel like that perfectly transitions us to what does it look like to do it? So I have a number of questions built into that question.
Okay.
I'll lay them out. And if I need to go back to some of them, you tell me. But what I'm curious about is, what would someone expect? How long would a session look like? How often do sessions happen? And how many sessions does it normally take for something like PTSD, as an example, to experience some amount of change that feels of like meaning and consequence?
Right.
No short or like small request here, right?
I know. It's like, okay, wow, those are very comprehensive answers that are required to answer those. No, but I
recognize that the answer is really, I can't answer this, Lindsay, right? Like everything's going to be different. I get that. But if we were to kind of give it a bit of a like, on average, what does it tend to look like?
Of course. Well, the first initial assessment, that's basically where we are measuring the brain waves with QEEG. And so what you do there is we basically have what looks like a shower cap, and it has pre-positioned electrodes on it. So it looks like this. So this just goes on.
So for our friends who are listening on the audio only version, Michael's demoing. So you should go check this out on YouTube. And for our YouTube watchers, you are in luck because we get like a full visual. Yeah.
Right. So essentially, there's pre-positioned electrodes, meaning it's based on a standardized 1020 system, and that won't change. So we know the areas consistently that we're measuring. And so that's
Yeah.
informed from research and what they do with neuroscience. So what we're measuring again is brain electrical activity with these electrodes. And
Yeah.
that's usually a 2-hour session. So it just takes time to put the cap on, to put gel into the different areas. And then
Mm-hmm.
what I like to do is spend extra time, though, to do a little bit of an analysis and then try to provide feedback right away during that initial assessment.
Right.
So usually about 2 hours. But that's where it can go from anywhere from 2 hours to, I try to give some extra time, because I think the moment that you start to see how your brain is functioning and then literally have visuals about, oh, look at the white
Yeah.
matter in the brain and the fibers and how it's actually functioning, it just raises so much both questions, but then also more of a validation, I would say. Like people just think, oh, wow, that
Mm.
makes sense. Like, of
Yeah.
course, that's why I'm feeling headaches, because I can see that this
Right.
part of the brain is not doing so well. And that's linked to perhaps the
Yeah.
experience of some headaches. So
Yeah.
that's the assessment. And then in terms of what we do after, I would say sometimes people get confused about all these terms that come across, like with regard to neurotherapy. So one of them is, okay, well, what's neurofeedback? What's biofeedback?
Mm-hmm.
So I think first start with, again, the assessment that we do. So that what I do is the QEEG assessment, that comprehensive assessment. And then two specific things that I do for treatment sessions is neurofeedback training, which is what often people
Okay.
hear about. And so neurofeedback training is when you basically help the brain and train it to increase or decrease, for example, certain frequencies that you want to
Yeah.
push the brain to adopt. So it's based on operant conditioning principles. So, for example,
Okay.
if you're working with a client that has ADHD, you would do is, let's just say that there's an increase in slow frequencies, so almost like daydreaming states in the brain. So what you
Okay.
want to do there is you would reward the brain when it's reducing those frequencies. And so it's as simple
Okay.
as there's a spaceship that actually moves whenever you're concentrating, whenever your daydreaming brain waves start to decrease. And so kids
Yeah.
literally train themselves to do this. So as they're
Yeah. So it's like
concentrating,
a
then this
video image,
moves.
right?
Yeah, that's right. It's almost like
Yeah.
a very healthy video game that you could do
Yeah.
for kids. And that has a lot of research, because that's one of the foundational, I guess, series of studies and researchers. They've looked at a lot of applications for ADHD using neurotherapy and specifically neurofeedback training.
Yeah.
So again, there's neurofeedback training, but what I've actually focused a lot more of in the past, say, 4 or 5 years, is what's called neuromodulation or
Okay.
neurostimulation. And this involves a number of types of stimulation. So what we're trying to do there is different principles. So one of the principles is what's called entrainment. So if, let's just say,
Okay.
we wanted to increase a certain frequency in the brain, what we're doing is we're actually going directly to that part of the brain and giving it that frequency. So it's the
Okay.
principle of, almost like with music, when you listen to something that's kind of a slow beat, you follow that beat. If it's
Mhm.
faster, you follow that rhythm. So the brain is like that. It likes to mimic or
Yeah.
copy frequencies.
It likes to
So it
mirror.
becomes
Yeah.
yeah, it's basically mirroring. So that's a very powerful tool to help guide the brain to a more healthy state, especially once you know what frequencies or what areas of the brain that you want to work with. So
Yeah.
different types of stimulation. I know this might be a long list, but I'll just name a few things. So there's
Yeah.
microcurrent transcranial stimulation, and I use that often.
Okay.
This is not ECT. So just to make that clear. So ECT, you see in the
I
hospital,
literally
but
had this
not
conversation with
electrocuted.
someone just the other
Okay.
day. Yeah.
Really, really. Yeah. So, and that's important. So that's why I like to use the word microcurrent, because I think, just even from my experience, the brain responds not to strong levels of stimulation. It's actually lower levels of stimulation. In fact, the brainwaves
Mhm.
themselves are quite low level intensity. We literally need an amplifier to measure them. So
Mhm.
that's a good thing, because, again, the microcurrent stimulation is very low. So to just give a baseline, with ECT, it's about 600 to 800 milliamps in intensity.
Okay.
What I'm using is zero point 0.1, 0.2,
Yeah.
zero point 0.3. So it's literally quite a magnitude lower than ECT. And that stimulation is very, very powerful because especially in neuroscience areas, you'll see a lot of research being done on specific areas that they either stimulate, so to do entrainment, what I mentioned, but also to either increase or decrease activity in different parts of the brain, which is what neurostimulation can do. And then just a third thing, another thing that neurostimulation can do is basically what could be called decoupling. So when you do a brain assessment, you might actually see that some areas of the brain are rigid, like there's a lot of communication, for example, but it's almost like people are yelling at each other and they're not really communicating effectively. So there's ways to actually almost like get the brain to kind of reset and say, oh, look, okay, let's stop what we're doing here. And then, oh, let's try to operate in this way instead. So there's stimulation that does something along those lines. Yeah.
So what does that feel like to be the person in the chair? What's that experience like?
I think it's exciting. And that's just a reflection on what I see with most clients when they come in. They're excited to actually basically work with the brain. I don't know how else to say it, but that really is how I would sum it up. It's an excitement that
I guess what I'm curious about. Yeah. Okay. So I guess what I'm curious about is like, if I were to imagine being in the room, what do I do? What do I expect I'm going to do? What do I expect? Like, do I sit in a chair? Am I reclined? Do I get to sleep? Do I have to do anything? What does it look like?
Mm-hmm. And I think oftentimes you'll see different practitioners do different ways of what that experience would look like. For me personally, I just like to have an environment that's really calm and soothing. So I try to, as much as possible, make things as less clinical as possible, less sterile. So I kind of treat it like, okay, it should be like a living room where you walk in and you feel comfortable, just to at that level help to make people feel comfortable where they're at. And so basically you would sit in a chair, for example, and depending on what you're trying to do in terms of a protocol, oftentimes you might, for example, if neurofeedback training, there's a screen that you would watch to do the training. So like that spaceship that I mentioned, you'd watch that on the screen. And then you'd be coached on how you're doing that. But often what's really cool about neurostimulation is, and this is where the integration comes, I do like to do a lot of psychotherapy counseling with clients while we're actually working with different parts of the brain. And to even tie it back to that example of PTSD with frontline workers, this is huge. I mean, oftentimes, I think some of the blocks that you'll see in psychotherapy is that, yes, you're doing processing. It's not that you're not. But because of a particular block like dissociation or trauma, you can go only so far. But if you actually affect change in the brain while you're actually doing that processing, I think that's such a kind of key element to making change, like with that particular condition, for example. Yeah.
Totally. I think that's the thing I'm most excited about. Because I think that's the piece that I see the most hope in, right? Like, and because I do exclusively trauma therapy, like that's 100% of my time. I see those block moments all the time where I look at it and go like, oh man, we're just like really hung up here. And I know we can keep working at this, but it feels like just this like gradual kind of painstaking effort. Where I hope that this brings more capacity for hope, that we can make kind of bigger, more substantial movements in some of those areas. I think you and I have talked about some of the limitations in having that maybe show up more in conventional therapy practices, and even in spaces like this where we try to be a bit more innovative, but there are certainly some limitations in jumping into something like this. But we can get to that in a minute. The couple of questions I want to link to in this is, how often do people generally do like the neurofeedback kind of training sessions, or like the decoupling kinds of work? Like, how frequently would that happen? How many sessions does that tend to look like? Is it something that people do for quite a long stretch of time, or is it like a handful of sessions and then they go back about their business?
Well, I think there's a whole range of possibilities. And I think on average, though, I would say that because of the nature of what we're doing, I do actually tend to see clients on a more regular basis. And also over perhaps what you would consider a longer period of time. And I think that's
Okay.
mainly because there actually is more changes that are occurring that we're doing. And
Yeah.
so what I mean is you might come in and want help with your sleep quality, but then we absolutely get to that. We improve your sleep. But then what happens is, well, that just relates to so many other issues that you might have. And then what happens is people just want to continue to optimize. And so
Yeah.
on average, I think because of that desire to optimize, I think people tend to want to keep working with the brain. So that's where I kind of get that long
Mm,
term type of
yeah.
response. But in terms of a response and how soon you might see a change, it could vary, but absolutely, it could even just be within that session. So, for example, I've
Mm,
just this morning, I was working with a client where she was highly anxious, and then I did one type of stimulation. It's called photobiomodulation, and
okay.
it was just really nice to see. Like it really helped to calm the limbic system, and suddenly she was able to
Mm,
just kind of reduce muscle tension in her body, relax, and that was immediate. So again, during session, you can actually see a change. And then, of course, what you
mm,
want to do though is make long-term change over time, and I think that's what you start to see. So one of the advantages, going back to the assessment, is that you can actually compare now. Okay, we did a brain
yeah.
map in the beginning. Let's see, we've done 4 sessions. What has shifted? And so you
Yeah.
have a person's subjective experience, which is so important. It's always missed
Hmm.
out or kind of minimized. So you really want to see what a client notices, even if it's subtle. But then again, you have that tangible physiological measure to compare with. And that
Totally.
is usually validating for clients as well. And so even if a
Okay.
client might not initially notice change, they start to see, oh, that makes sense. There was a shift here. And then actually things might have felt like it was getting worse, but it was because you were connecting to your emotional states more. And that was part of the
Mm,
process. So
yeah.
perhaps that might lead to some other questions that you have, but there's different responses that people have. And that's why I say there's still a broad range of possibilities. So,
Mm.
yeah.
Yeah. Well, and I know that this is used for such a diverse range of like
Mhm.
symptom presentation and diagnostic pieces. And so fair that there's maybe not like one really great solid, well, the average is 6 sessions and you come weekly for 20
Mhm.
minutes or whatever, right? Like that's fair.
Right.
I just always think it's
It's not what I'm
helpful because I
promoting.
think
Yeah.
I get that. That's fair game. I think as like when I think about being the consumer of a service, I always like to have a bit of a sense of knowing what I'm getting myself into.
Mhm. For
Right.
sure.
So like I've been to like doctor's appointments that I expected were going to take 15 minutes and I was there for four
Yeah.
hours and I
For
didn't
4 hours.
plan for that. Right. Like
No,
so
no.
knowing
It's
like
expectations.
right, like being able to kind of shape what I can imagine
Mhm.
that's going to be like helps me feel
Mhm.
more inclined to say yeah to the thing than
Yes.
feeling like I have reservations about it.
Right.
And so I think even just knowing that, like, even within a session, I might notice something different, like that feels
You can.
motivating.
It is motivating. And then if you
Yeah.
wanted to talk about averages, so let's now go into that. So
Yeah.
like on average, I think do people do notice positive changes in their symptoms at least from like a few sessions, say 4 to 6 sessions. Most people on average, again, at 4 to 10 sessions, maybe up to 10, and then they start to realize that something is shifting. So there's
Yeah.
a number of factors for that. But again, just as an average, say 4 to 10 sessions. And
Yeah.
the reason why I say that it's so broad too is, I mean, in my situation, I'm seeing all kinds of clients too. So what
Hmm.
that means is if you see someone with traumatic brain injury, stroke, that will
Yeah.
likely present differently, for example, than someone that has seemingly the common, issues with like sleep issues
Totally.
or anxiety. But
Yeah.
then other people have multiple things as well that they're concerned about.
Totally.
So it's a question of, okay, you want to improve your number one issue is anxiety. So let's work with that. And then there's other things that you want to optimize as well. So then
Yeah.
that's when things become more seemingly like there's more sessions. But again, it's just trying to optimize as much as you can, at least how I see it.
Yeah.
Yeah.
That's fair. Okay. So then I'm going to jump to kind of like the flip side of it. Are there things that this doesn't work well with? Are there any
Mm-hmm.
contraindications to using this approach or people for whom it wouldn't work or the circumstances wouldn't be safer in their client's best interest?
Hmm. Well, I think one of the things that you have to look out for when you're doing neurotherapy is, I don't know, it's not everyone, but sometimes I think people think, almost like with yoga and meditation, that, oh, there can only be positive benefits from this and nothing negative
Right.
can happen. But the reality is, if you're affecting huge, significant positive change, you have the capacity with that modality to make negative change. And so,
Yeah.
as an example, what I mean is, if we know, for example, that person with ADHD has an increase in slow frequencies, like technically you could train that frequency higher and make symptoms worse.
Mhm.
So that's why,
Right.
again, going back to the comprehensive assessment, you really want to know what is happening in the brain, explore that with a client, really listen to their concerns and symptoms, and make good clinical judgments about what protocols you're going to do. Because absolutely, you can
Mhm.
actually make things worse in one sense. But having said that,
Yeah.
so that's one of the first kind of contraindications, is you want someone that does have some experience and knowledge about
Mhm.
multiple levels of how the brain waves function and different networks and all those things.
Right.
Another thing is, oftentimes it seems like a negative symptom. It's part of the process, but oftentimes people might have changes that subjectively feel negative. So, one of the examples, actually, again, with PTSD, is that if you have someone that's dissociated, they're not connecting to their emotions. And then suddenly, when you're
Mm.
doing therapy, neurotherapy specifically, they
Yeah.
actually have the ability to connect to more emotional states. But that's the full gamut of emotions often. So they
Right. They
might
don't all feel
suddenly
good.
have irritation, frustration. They don't feel good. I feel a bit sad. I
Yeah.
feel anxious, depressed. But they're actually connecting to them now. So
Hmm.
it's important for, I think, a therapist to be able to, first of all, support that. To
Yeah.
know almost what to do when things like that happen, like when there are emotional releases, but then also to let clients know that that is a possibility, for example, that these are symptoms that you
Totally.
might connect to, but it is likely part of the process. And then again, what you
Mhm.
have as another tool is that assessment. Again, you can actually show a client, oh, this is how your brain is shifting. We can actually see that the limbic system is a bit calmer and it's now connecting to your frontal cortex and your cognitive network. So you're
Yeah.
actually experiencing things more. So that's okay. But yes, we
Mm.
don't want you to have be overwhelmed by this. We want to help you through this process. So again, that's where
Mhm.
having different tools and even modalities to help with that would be important during those times.
Totally.
Yeah.
Well, and it's funny because I think that it's one of the things I often say to clients is that when we do trauma therapy, where we're processing and we're trying to reduce layers of dissociation, it often feels worse before it feels better
Mhm.
because of
Mhm.
that exact experience of like as we move past the dissociative kind of layers and walls that
Yes.
our brain and body have put up in order to be able to function.
Hmm.
And we try to touch in a little bit more to actually how we're doing, actually how we're feeling.
Right.
Sometimes we're opening like cans of worms we haven't opened in decades. And
Hmm.
it does feel much more uncomfortable before we get to more comfortable. And so
Yes.
I think it's really important that we kind of advise and support clients and again, knowing what to expect, setting expectations so that they don't feel like, oh my gosh, I did therapy and I'm worse.
Mm-hmm. And then it was a
Yeah. Because
surprise
that's
because
always a
they weren't
hard thing
told
to
that.
feel like.
Oh yeah, oh yeah, of
Right?
course it
Well, and it
is.
was supposed to help me. I'm supposed to feel better. Like you broke
Right,
me.
right.
I'm worse than when I started, right? Like I think we set
Yeah.
ourselves up as therapists for having a bad rap if we don't do a better job
Yes.
of preparing
Yes.
clients for the fact that that's how it can feel.
Well, absolutely. And it's
Yeah,
basically psychoeducation about the processes, right? Like if we just educate
totally.
clients about what likely are possible processes, then that's actually, it's not even about trying to manipulate or just tell them, oh, this is how it's going to
Yeah,
happen, or, oh, you'll be fine in 4 sessions, or this is when you're going to notice things.
right.
I think some people do that, but I think just being
Yeah.
genuine and honest is so important
Mhm.
because it's
Yeah.
partly why you're able to get clients to actually be able to connect to what you're doing and then also to share and to be able to be vulnerable with you. Yeah.
Now, it sounds like the actual answer in the grand scheme of things isn't that there's really contraindications in terms of what a client might come with, and right, like a diagnosis or a symptom set or whatever. Most of it can benefit from this in some way, shape, or form. It sounds like the contraindications are more related to the clinician and just that the clinician has sufficient experience and understanding to be able to do what they're doing really well. So this is a question I didn't prep you for, and if it's not cool to ask, that's fine. But I guess what I'm curious about is, are there ways to know the difference? Are there things that people as consumers should be looking for in the type of clinician that they seek out that can give them a sense of confidence that this is someone who's quite competent, as opposed to
Right.
someone who's maybe not so much?
Yes, yes. Well, I think if you go into the research, and you might ask me about the research, but there absolutely are levels of efficacy that have been established for certain
Okay.
conditions. And so that's where you would perhaps put that in as contraindications. For example, there's levels of, I believe it's 80, no, it's with autism, the spectrum.
Okay.
Basically, it with the AAPB, which is one of the bodies that regulate, or
Mhm.
at least promote biofeedback, it at this point in the research isn't necessarily shown to be significantly effective for working with
Right.
autism. But what's interesting
Yeah.
is clinicians are still using that, and researchers are still using neurotherapy. And I think the reason is
Mhm.
because like the research just hasn't caught up yet with
Yeah.
understanding. And something as complex as being on the spectrum itself, it's very difficult to show efficacy with certain types of conditions because it's quite
Mhm.
broad with the possibilities of change and how a person is experiencing symptoms. It's not as easy as
Mhm.
like other conditions where you can really just isolate a symptom or a particular condition. So people,
Mhm.
to get reassurance, I think one of the things to do is, first of all, probably look at the background of the practitioner. So there's a organization called the Biofeedback Certification International Alliance, BCIA, and
Okay.
on there, it's basically the main regulatory type of body that's
Yeah.
regulating neurotherapy. And there's a list of practitioners by region in North America and also parts of other parts of the world that you can look at practitioners that have at least that certification. And I think that's at least a
Mm.
very good standard for people to have that, oh, it's not just someone that picked up on some system and started utilizing it with clients. They at least know the history of how things have developed, the
Yeah.
different researchers that have been involved, and the different clinicians, and what the current state of neurotherapy and biofeedback overall has been. So I
Yeah.
think that's important. Again, looking at the
Yeah.
background of the clinician. And then I just
Yeah.
wanted to
That's
tie in
fair.
back to your question about contraindications. I think, and it does tie into what the experience and the understanding of a clinician is, but I think there are conditions where just intuitively and also with the research, you might not want to necessarily delve into too much with, say, some of the
Mhm.
specific types of treatments. So it gets kind of
Okay.
broad and a little bit more dynamic than just to say, oh, you shouldn't use this for this particular condition. But for
Right.
example, let's see, a lot of neurotherapy has actually been used a lot with like seizure activity and people with
Mhm.
epilepsy. I personally, right now, am not wanting to take on clients with seizures just because,
Mm.
in my opinion, I think there should be really important support mechanisms that I can't provide at this type of environment that I have now to allow for
Yeah.
proper treatment and also support in case there are seizures that occur. And so
Yeah.
that becomes an important understanding of each condition that, okay, for example, with traumatic brain injury, I often want to have at least the knowledge that they're seeing a neurologist because you want them to be doing their
Yeah.
levels of expertise and their understanding to assess and see if even neurotherapy is okay for them to do given what their condition is with the brain.
Yeah.
So I think that also ties into to help with knowing if something is helpful is to make sure that it's not just, oh, it's a one size fits all thing where, and unfortunately I see that
Yeah.
sometimes people see multiple types of modalities, and then I become this last resort almost, where clients come in and then they
Mm.
just want me to kind of fix them. But I think it's so important that you're working with oftentimes like multiple people so that you're actually getting the benefits of whether it be psychotherapy, uh, neurologists, depending on your condition, and then other types of
Mm.
therapies to help with your condition.
Yeah. Yeah. I mean, it's not like a magic wand, right? And I
Mm-hmm.
think that's the thing that all of us as consumers wish we could find. And isn't that what we kind of feel like with everything? We want the pill that just makes it all better. Or we want, whatever the easy thing is. And I don't think that neurotherapy is going to be that thing, but I do think it's cool that it kind of dives to the heart of things differently
Mm-hmm.
by really connecting to the like mechanisms where the broken things are happening in a
Mm-hmm.
different way than we can when we talk about like talk therapy and things like that, where we're really only scratching the surface of what we could be accessing and could be supporting differently.
Mm-hmm. Mm-hmm.
So I love that you're kind of advocating for this integrative care kind of model, because I think that that's really
Essentially,
valuable. But
yes,
for sure, it's
yes,
cool to have this be. I wish that this were a piece that more people knew about as part of their
yes.
own comprehensive care model. Behind the Line is sponsored by Beating the Breaking Point. Beating the Breaking Point is a 7-part online training program designed specifically for first responders and frontline workers, and tailored to fill the gaps in your training to support resilience and sustainability. Whether you're new to the work and wanting to cultivate tools to prevent burnout, compassion fatigue, and related concerns, or you are deep into your years on the job and have gone a few rounds with burnout and other mental health challenges, this program offers the foundational pieces you need to support personal and professional wellness for the long haul. You are a helper. You love your work and you sacrifice a lot. Investing in you and your sustainability is the best gift you can give yourself and those who lean on you. We make this program as risk-free as possible by offering a limited money-back guarantee to ensure that it's a fit for you. If you enjoy Behind the Line, you are going to love this program. Google Beating the Breaking Point Lindsay and find everything you need to get started, or use the link in the show notes. Now, back to the episode.
Well, even as an example, so I'm really focused, of course, on the brain, but it's almost impossible not to realize that the body is such a huge connection to that. So I think you might know about the gut-brain connection. So how your stomach, how your body is doing has a huge impact on how your brain is functioning. So addressing that with either a naturopath or I like, for example, functional medicine doctors that actually look at that as part of their practice, and it's more integrative. That to me makes a lot more sense. So again, it's starting from that being able to be comprehensive with the brain, but then also the body and everything else that would be important. Yeah. So just to also circle back, I know that just because there's so many things that I could talk about, I think you were mentioning about what a session would look like. So I mentioned about the cat, but what I wanted to talk about is, again, some of those stimulations, for example, that I do.
Yeah,
So
totally.
let me just show you a few things. So one of the stimulations,
it's like show and tell time.
Yeah, pretty much. And of course, I'm a gadget kind of person, so I have tons of gadgets. So maybe for people in the audience that don't have a visual here, you can describe what I'm doing. But basically, there's coils that we use that create what are called pulsed electrical magnetic fields. And so this field is what you see with like pretty much all electronics. But what's really good about it is you can actually set it to the frequencies that you're wanting to help the brain to get entrained in. So again, if you want to calm the limbic system, you would put the coils in a location that would help to bring calmer parasympathetic frequencies to that part of the brain that it's lacking from the assessment that you're seeing. So that's one powerful way to go right to that area. Another type of stimulation is the one I mentioned in the beginning, which is transcranial electrical stimulation. And so what that looks like is there's basically 2 electrodes to maybe 4 or 6 electrodes that you would put on. They just stick on top of the head. And from this, I would target the areas that we're seeing from the brain map. And so I might not have talked about it too much, but when you look at the comprehensive assessment, you're not just measuring, and this is so important, you're not just measuring the top of the head. From the top of the head, you can see so much about different parts of the brain that are deeper and how they're functioning. Like, for example, different networks of the brain, the default mode network, the resting state networks. There's even networks for specific conditions. So what I mean is when you're talking about anxiety, there's a lot of research that's already been done that have linked different parts of the brain that are active when you're in a certain condition. So let's take a look at that
Yeah.
network and see how it's doing and how that relates to your symptoms. So it becomes that specific.
Totally.
We can target a network that's related to your condition. Yeah.
Mm-hmm.
And then just one
Yeah,
more.
which was, I
Keep
think,
going if
your
you
master's research and mine vicariously.
And here's a fun one. So this is not a bike helmet, but it does look like one. So
Okay.
this just goes on top of the head. I realize what it reminds me of. It's the Padawan learners when in Star Wars, when
Yes,
the
totally.
Jedi's,
Yeah.
they're wearing that and then they have the sword.
Yeah.
Anyways, so what this
Yeah.
is it's what's called photobiomodulation. So it's another type of stimulation,
Okay.
but it's using infrared lights. And the
Okay.
analog to it, you might have heard of red light therapy for the body, but basically it's a
Mhm.
wavelength
Yeah.
that you can't see, infrared light that stimulates the brain. And so what we're doing here
Okay.
with the research, what you're seeing is that there's an increase in ATP production, so energy to the cells. You're seeing
Okay.
when you're using photobiomodulation, you're seeing reduction of inflammation, increased blood flow to the brain.
Mhm.
So essentially all things that are so significant for healing and
Right.
promoting the brain
Yeah.
to function better. So you're going to
Yeah.
see that with the research increase to not where it's currently at, which is usually with traumatic brain injury, it's been applied to dementia,
Mm.
memory issues. But because it's operating at a cellular level and improving things like reducing inflammation, you're likely going to see it applied to a number of things, such as mental conditions, anxiety,
Mm.
depression, absolutely depression. You'll see that there's certain frequencies that tend to get increased when you're doing that type of stimulation. So there's a lot that you
Mm.
can start to do to really optimize and help the brain to function better. And I know I keep saying that, but it just seems so fundamental to us. And oftentimes it's just, to me, the missing piece. Sometimes we're trying to do things, but we're not actually looking at the controller, the computer, so
Yeah.
to speak, of this whole system, which is our brains. And why not try to understand it more, explore together, see how it fits with your symptoms, and then use that, work together to understand your brain and then actually affect change to the brain. And eventually, of
Totally.
course, your symptoms and your different concerns or conditions.
Okay, so let's now that we've established how fantastic this tool is, talk about why not everyone is using it.
Uh, so,
Like, why do you think that this
why
isn't
do
being
people?
used more conventionally?
Mhm. Well, I think one of the things is maybe the complexity of it. So if
Yeah.
you hear me talking, I already mentioned probably 4 or 5 types of stimulation and treatment that you can do. So I think people, perhaps, for example, with clinicians, they struggle to integrate it into their practices because there's
Yeah.
just so many possibilities. So you
Mhm.
might see a client or a clinician try to integrate it with, for example, with trauma therapy. And I think
Mhm.
there's times where they might see success, but what might be missing is maybe that first piece, that comprehensive
Yeah.
assessment. So they might not be doing like a QEEG or a full brain map. And so they might
Mhm.
see changes, but then they start to kind of use it haphazardly because it might
Mhm.
work with certain situations, but not with certain clients.
Yeah.
And I think that's why, because there's a missing piece that's usually there.
Mhm.
So it might be the assessment or even sometimes the training modalities. People might just use one type of treatment. So it
Mhm.
might just be neurofeedback training. And again, not to put down just neurofeedback training, people have had huge success with that over decades. But oftentimes you might see that it would take 40 sessions until you start to see changes when you're just doing straight neurofeedback training. And so when you start to combine and look at different treatments as tools, then it actually makes sense that the more that you have at your disposal, you're able to affect more change, perhaps. And as long as you're
Totally.
doing that comprehensive assessment, then you can see what areas of the brain might benefit from this type of stimulation and maybe not this one. So that
Mhm.
understanding just comes from, I guess, more experience, but just time as well. So you'll see less
Yeah.
clinicians maybe less effectively integrated into their practices. And then the ones that do, it's just a certain type of symptom or condition that they might be working with. And that's totally fine. But again, that might not
Yeah.
necessarily promote it to be used with a larger gamut or a broader range of conditions. The
Sure.
other reason I would say is probably just the politics involved with how
Mm.
almost threatening neurotherapy is. Because if you look
Mm.
at the state of, for example, psychology, just as an example,
Yeah.
often they would want to do assessments based on, the paper and pen or online assessments where you answer a number of questions, a battery of tests, and there's validity to that. But what it's threatening is it's not actually measuring how your mind is functioning, which is basically your brain. And I don't know
Totally.
how many times you'll see, again, there's usefulness to the assessments, but you'll see a client do a battery of tests only for that to say that, oh, you have moderate anxiety. And the client already knew that.
Mm.
And it didn't really
Yeah.
provide any more additional information or even routes to actually
Totally.
work with that anxiety. And then you do a brain map and you would actually see, oh gosh, it's this part of the brain, it's this network, and oh, you likely would benefit from this type of treatment or even another type of therapy because of what we're seeing from the brain. And so
Totally.
because of that, you'll see that discrepancy where a lot of fields are kind of threatened that, oh, the whole way that we're doing something might not be as efficient as we're doing it. And so I think you're seeing
Mm.
some pushback from that, but are also
Yeah.
seeing changes. Like some of the fields are opening up to the use of it. And
Yeah.
another example, just one more, is the medical field. They often
Mm.
use brainwave EEG and electrical activity, but it's usually limited. They're looking at the morphology
Yeah.
or the waveforms and looking for spikes,
Yeah.
for example, for seizure activity, but they're not looking at it from a functional standpoint, like, oh, how is your brain is functioning and how can we use that to actually do other types of stimulation or types of treatments towards the brain.
Mm.
So it's somewhat
Yeah.
limited. Yeah.
Fair.
So those are kind of a few
Yeah.
reasons for it. There's probably a number of other ones, but those are the a few of
I
the main
mean, I
ones.
can tell you that the number one obstacle for me is it's so extraordinarily cost prohibitive.
Mm, mm,
So because of if you want to do it well, you want to do
yeah.
more than a thing. And
Yes.
each of the things are like 20 grand just for the equipment
Mm,
before you even get trained in how to use it properly. And that training
right.
is, years of your life on top
Yes.
of what you've already done in master's level,
Absolutely.
sacrificial lambing your life to this.
Mm,
It adds up really quickly. So I know you and I had a conversation where I had said like, okay, so if you could pick one thing, what would it be? Because I would love to see this be used more. I would love to see it integrated into our
right.
clinic.
Right.
But for sure, it feels so overwhelming as a clinician to think I
Yes.
already have
Absolutely.
a full caseload of clients. I'm already maxed out. I want to add this to help. But now to do that, it's like
Hmm.
such a big mountain to climb.
Hmm. Hmm. And I think
Yeah.
so. It is a huge factor. So the finances towards training and then the equipment itself and the software, it is quite expensive. And then
Hmm.
it does take someone that would really want to be passionate or connected to it and find it meaningful,
Yeah.
and but determination with that, because even if you
Yeah.
know that it's helpful, if you're not determined enough to, what, I'm just going to keep learning. So those are obstacles. Another obstacle is simply
Yeah.
what you just mentioned. So with equipment comes understanding of, if you're not necessarily technical or working with computers is perhaps an issue.
Yeah.
Unfortunately, there's a lot of software, there's a lots of different kinds of analysis. So oftentimes I see that with people as well, that could be a barrier as well, like
Mm.
the comfort
Yeah.
levels with different equipment and technology.
Yeah.
But it is
I
based
do
on
also think that
technology.
like as a clinician, it's also harder. So like other types of things have like a more centralized training model, right? So like
Mhm.
EMDR, things like that, you go to
Right,
emdr.com and you sign
right.
up for a
So
training and you
structured,
can get it,
so structured.
right? Like it's so structured and it's so centralized. It's the same with like sensory motor
Mm,
therapy or like other kinds of treatment mechanisms. There's a very centralized way of
mhm.
accessing the training and any equipment related
Yes.
to, et cetera. With this, it's so varied and all over the place. And like even a like very quick Google takes you down a zillion different rabbit holes.
And
And
it's
you kind
whoever
of leave
has
it being like,
higher,
I don't know where to start.
and you won't. And I think,
Yeah.
I don't know, one of the issues that I'll bring up in terms of why it's not necessarily understood or known as well as it should be is also because of the field itself. So what I mean by
Yeah.
that is exactly what you described. When you do a Google search, you're going to see system here, different approach here.
Yeah.
There's a lack, in my opinion, of integration or at least even respect with some of these people that are doing the neurofeedback. So you'll get one person with, oh, here's this neurooptimal system, and I swear by this system, this is the best, and I'm not going to do anything else. And then you'll get this other
Yeah.
group that, oh, we only use databases and this is the best approach and we're only going to do that. And so I find it personally difficult, even as a clinician that's experienced in this, to actually navigate to say, you know what, actually I can utilize this piece of what you're doing here, but I can also utilize this. And I think
Totally.
from that, if you're able to have the, I would say, I guess, luxury to have the time and effort to look at multiple approaches and systems within the field, then suddenly things
Yeah.
do become more clear. And so
Yeah.
I can actually start to tell you, you know, I think this might be helpful for your particular population that you're working. This might be a better route to really focus on this, but also add this piece to it as well. So
Yeah.
through that experience, you get to see that there's multiple systems. And I think navigating that is a challenge. But I think over time,
Yeah.
you will get an answer if you just be determined to get through all the
Right.
different systems and the costs and different approaches.
This is now the quest I'm going to have to be on, Michael. I mean, I guess the take home message for those listening, because they're probably like, okay, you're now nerd ranting, guys, is that part of why it's challenging to maybe find someone who does this and find someone who does it really well, is that from a clinical perspective as professionals, it's not the easiest thing to jump into. And so you might find that it is harder to find someone who's great at it, and who does it in some of the ways that Michael's shared about, because there's a lot of layers of barriers for us as professionals to get our own access to it, to be able to provide it as a service really comprehensively to people. So I guess then my last big question, Michael, would be, how can people find out more about you, about neurotherapy that is more comprehensive and able to kind of attribute for the complexity of people's situations, brains, diagnoses? What would be like next steps for someone who listens today and is really curious and wants to see what comes next?
Well, as you can tell from the interview, I just love talking about this stuff. So I could just keep going on and on and on. So,
I know we could be
for
here
example, I mean,
forever.
with myself, I just love connecting to like new clients and just talking about the process, because it does take time and investment, but it's so enjoyable for me to be able to do that, to talk about all these different kind of questions and trying to understand what could be helpful for a particular person. But that's where, again, having different experiences to share with a client is important. So, for example, with myself, you could contact me through my phone number. So I can give that to you, or did you want me to describe it here, or just
If you want to shoot me, why don't you just shoot me some of the information that would be most helpful for people to contact, and I will make sure all of it is in the show notes. So for those listening or watching, you can find it there.
Right. And I'll give you my updated website soon. So probably within a month,
Okay.
that will be up and
Perfect.
going. In terms of other resources, so there's a few of them. One of them is the one I mentioned already, which is BCIA. So you can just Google that.
Okay.
It's, again, the Biofeedback Certification International Alliance, and they're the main regulatory body that helps to promote standards for neurotherapy. So that's a good place to get some information about at least neurofeedback, and then also biofeedback, and a list of practitioners that are within different regions. So that helps to kind of give some standard. And then another website is what's called ISNR. So it's the International Society for Neuroregulation and Research. And it's a good resource for describing about what neurofeedback is, QEEG assessments, and all the research. Like, there's just so much research that's been done for the decades, which I don't know if we kind of covered, but this whole practice has started probably from, I'd say, this individual, his name is Hans Berger, who first measured brainwave activity in the 1920s. So there's a whole progression of, this has been around for a while, and then it just evolved and just continues to evolve at an exponential rate at this point.
Yeah.
So I really do believe it's the cutting edge of what you'll start seeing with applications in medical fields and psychology eventually. Yeah.
Yeah. I mean, that for sure does seem to be the trajectory that we're on. And I can't remember who it was, but one of the like major players in psychology had talked about how they believe that the new name for psychology and psychotherapy down the road will be brain science and brain therapy.
Yes.
And it's because of this, right?
Totally. Just because I am, I guess, a nerd, can I just describe one more thing? So essentially, I mentioned about different types of therapies. So I mentioned about neurofeedback, neurostimulation. So another thing that I really enjoy doing is what's called just basically biofeedback. So it's more specifically peripheral biofeedback. So you can measure the brain waves. So that's neurofeedback, and referring to neurotherapy too.
Yeah.
But with biofeedback, you can also measure other parts of the body. So you can measure things like heart rate variability, skin conductance, respiration, temperature, muscle tension. If you really think about these things, these are all important for the physiological responses, for example, of emotional states. So we can help clients to literally regulate their emotional states because we can actually see how their brain is functioning.
Yeah.
So it's literally the same sensors that you might see in a lie detector. I'm not going to be doing that type of assessment with clients, but my point is you can actually start to regulate. You'll see someone with anxiety and they don't realize because they've never been able to have access to this information. Oh, you think you're actually relaxed, but you're not. Look at all the tension that's showing up in your muscles right now, or your temperature is so low, so there's less blood flow to your peripheries. So that means that your blood flow is more to your core organs when you're in a more anxious state or in a sympathetic state.
Yeah.
So if you can help to use those measures to train yourself, and then you teach yourself literally to regulate those states, that's another application, major application for frontline workers. And it kind of ties into what I want to do is to kind of develop some products where it would be more accessible to the consumer, not just in a clinical setting, but just people in general, to be able to measure how their body is functioning and to help train themselves to get into, at the very least, parasympathetic or calm states. And you can do that with biofeedback training. And that is one of the things that with the AAPB, I mentioned the efficacy levels. That's like literally one of the highest efficacy ratings because biofeedback has been around for decades, just measuring body processes and training it. So we haven't seen that enough of. So anyways, I want to mention that.
I love it. I love the nerding out together, Michael. I would nerd out with you all day, every day, if I could, because this was fun. This was super fun. Okay. I'm curious if you have any final thoughts, anything that you're going to regret that you didn't touch on or say. And if not, then we can sign off.
Okay. Well, I just wanted to first thank you so much for having me on your podcast. And just from what you've described, I'd love to know more details about what you are doing at your clinic, and then also just with this podcast. But from what I've seen, like, I think it's such a crucial thing that has been missing. It has been on my mind. I've actually talked to a number of therapists that it just makes sense to try to see what is out there in terms of other unconventional therapies, but kind of bring things together, because so many people are missing out on what are such huge inroads and literally the cutting edge of what we can do. And it's just not being applied enough. And there's just too much, for example, confusion or politics involved with why it's not happening. But I think frontline workers are just not addressed with as much. So I think your podcast is just opening eyes for your viewers to so many possibilities of what can be helpful for them.
Yeah. Thanks, Michael. Yeah. I mean, I think that, when I think back on like why I got into all of this to begin with, it was like the whole, I just want to make a difference thing, right? Like, and that was like why I got into therapy. It's why this podcast exists. It's why I want to figure out how to add neurotherapy as a thing in our clinic. Like every single thing is just like, oh, I see so much hurting. I just want to make it different. And I think that there's so many of us like that, right? And to some extent, I think it's why our audience is often struggling as much as they're struggling, is because they have the same heart. They are out there working and grinding every day in systems that don't appreciate them enough, and ask way too much of them for way too little in return. And then they're left trying to figure out how to piece themselves back together when they've kind of been chewed up and spat out by the whole situation. But they do all of that because they want to make a difference. And so I think it's a population that I just like, I feel it. Like, I feel like we're aligned, that we all go into it with this goal of just wanting to make the world a little bit better and make a difference. And it's hard that so much of their work does cost so much.
And I think as you're doing this, you're probably going to start realizing that one of the keys to actually providing this and having this accessible to frontline workers is to actually have a structure now, or even a sequence. So most people have difficulty just knowing where to start, right? So if we as clinicians start to work together more and more truly, genuinely integrate, we can actually see something like, oh, you're coming in with this particular condition. Well, guess what? We know that you might benefit from doing this assessment, doing some neurotherapy, doing a brain map, doing physiotherapy, doing seeing counseling. But then if you're able to integrate it and know what's important for when, and then having a structure for it, and a place that actually understands and respects different modalities, then you're onto something where people actually have access and then know how
it's
to.
Like, you believe collaborative care is possible, Michael.
Yeah.
It's so beautiful.
It is possible.
I mean, it feels a little bit like innocent and naive right now, because I feel like the world is not going that direction. But I like 100% feel like that is my heart in this. Like, I think about my great hopes and plans for what I hope our clinic looks like, even 5 years from now. And 100% the goal of it is, how do we make it increasingly wraparound care for the people that we're serving? And I wish that was everyone's angle in it.
I think even just going back to when I mentioned what I do that's unconventional, which actually just is logical, I think you have to start with like a comprehensive assessment and analysis. So understand the different modalities, whatever it might be: physiotherapy, a naturopath, a nutritionist, a doctor, psychologist, neurotherapy, but put in pieces of assessments from each of these. And then on the front end, a client would likely do a number of these assessments. And then again, the more information, the more comprehensiveness that you have in understanding, then it would make sense. Oh, the functional medicine doctor is mentioning that there's gut issues. So let's work on those gut issues first. Definitely do a brain map so that we can at least track things, and then go from there to doing counseling, but only after this has happened. So again, that integration piece first starts with understanding and exploring, what are...
Well, and it's so in alignment, right? Like, we talk a lot on this show about how any change, good, bad, or otherwise, frankly, but like any good change has to start from a place of awareness. If we don't know where we are and we don't know where we want to go, we can't get there. We can't, like, we're not just going to magically happenstance end up in an awesome place when we haven't kind of taken an inventory. So a lot of what we talk about on the show is, how do we slow ourselves down? How do we like stop and take stock of where we're really at and how we're really doing, so that we know what's not working, we know what's deficient, we know what's tripping us up, we know where we're struggling. Because we so often get caught in the just going and doing kind of autopilot mode of life, that we don't even realize how depressed we are until we're so far down the hole that it's now like impossible to feel like we can dig ourselves back out. But like, that didn't just happen.
No,
we didn't just magically show up in depressed land one day. Like, it was a steady decline. We just never stopped to notice, like, oh, yesterday I felt here and today I'm feeling here. Oh, look, and tomorrow I'm down here again. Oh, that seems like there's like a trend, right? And so it makes sense to me that that if we're asking people to do this on an independent, individual, day in their lives level, of course we should be doing that same kind of assessment process. where we're really taking an inventory, we're really taking stock of where someone's at so that we can figure out how we get to where we're trying to go. How do we know what better looks like if we don't know what we're starting with?
Yeah. No, totally.
Okay. So you and I were just going to figure out how to change the world, and it's no small problem.
Yeah. Right. We're going to do that.
Right. Okay. I feel like I really need a glass of wine now. I feel like that's going to help. Okay. Well, Michael, I just really want to thank you because this was a really fun conversation. And I'm really excited to see what people take from this. I'm really excited to see how many phone calls you get. I hope you let me know. I hope those in our audience listening let me know. And if anyone has any questions who's listening, also feel free to reach out on any of our like social media channels or by email, because I would love to answer what questions I can answer, which probably isn't a ton. And what I can't answer, I will happily direct back to Michael.
Wonderful.
Awesome. Well, thanks so much, Michael. We will talk with you soon.
I really enjoyed this. Yeah. Okay. Take care.
Awesome.
I want to extend one more big thank you to Michael. What a gift to be joined by such an incredible expert and innovator. As we wrap up today, I want to remind you about our listener feedback survey. We're asking your feedback to help shape the future of Behind the Line to ensure that this is meeting your needs and covering topics that matter most to you. You can find the survey link in the show notes as well as on my social media pages. If you complete the survey before September 30th, you'll be entered to win a $50 Amazon gift card. Also, please reach out and connect if you have any questions or feedback. You know I love hearing from you and shaping this podcast to echo your needs and interests. I love hearing about what you're working on and how you're using what we talk about on the show. You can find me on Facebook and Instagram at Lindsay A. Foss, where you can follow me or tag me, or you can email me at support@thrive-life.ca. I'm grateful that many of you are keen to share about Behind the Line and spread the word to others on the front lines. Thank you so much for sharing with those you know. Know that we can be found online on our website, on most major podcast platforms, as well as on YouTube. Click subscribe to get alerts about our latest episodes, or subscribe to our email list to hear from me about all the exciting things we have going on and coming up. You'll find all the details you need in the show notes, along with links to our free Beating the Breaking Point Indicators Checklist and Triage Guide, which helps you facilitate self-assessing burnout and related concerns. We make all of this available to you because the work you do matters. But more than that, you matter, and we want to make sure that you have what you need to keep up the good work at work, as well as in your real life outside of the work. So use it and share it, and until next time, stay safe.